I'm William Fisher, Distinguished Professor in the Department of Psychology and the Department of Obstetrics and Gynecology at Western University in London, Canada. I approached the question of the effectiveness of applied kinesiology from the perspective of a hard scientist. I run clinical trials, I do systematic, statistically controlled research. I've published about 250 papers, and when I became acquainted with the assertions concerning the success of the applied kinesiology treatment articulated to the management and resolution of emotional distress, I suggested that we look at it from a systematic scientific perspective. So the first approach that we adopted was to select absolutely randomly and absolutely in a blind fashion 100 cases of treated patients. We compared statistically their feelings of emotional distress in a variety of domains, ranging from social relations to the ability to sleep to the ability to work with superiors. And following the applied kinesiology treatment, we followed up with measurements of the resolution or lack of resolution of their emotional distress. Somewhat to my surprise, as a systematic, hard-nosed scientist, we found a very, very high level of self-reported resolution of the presenting emotional distress. Now, I'm rarely satisfied with a single instance of demonstration of a scientific effect, so I upped the ante. And I said, you know what, I'd actually like to look at the degree of positive impact of applied kinesiology in every one of your patients, a series of every one of your patients in an entire year. How does this work? What is the impression of resolution of emotional distress, or what is the failure of the treatment? I'd like to replicate this on every single patient and learn from their self-reports how they fared in therapy. The record keeping at the Aura Golan Clinic is quite systematic, and pre-therapy and post-therapy measurements of emotional distress were available for every single patient, 691 patients, seen at the clinic in an entire year. Statistical analysis revealed an equivalent level of resolution of emotional distress in the entire series of 691 patients seen during an entire year. Again, as a resolute and hard-nosed scientist, I wanted to push this to the wall. And I said, can we do it a third time? The clinic then produced the records of an entire series of all patients seen during a succeeding half year, several hundred, 300 plus patients. And for a third time, the positive impact of applied kinesiology treatment at the Dr. Aura Golan Center was demonstrated in a highly consistent way. So we had 3 replications of positive impact of a relatively inexpensive, brief, and highly effective treatment. But again, as a skeptical scientist whose life has been spent as associate editor of journals, rejecting most of the papers that we get to review, and embodying the skepticism that is appropriate in science, we asked further questions. Was the treatment differentially effective depending on the nature of the presenting emotional complaint? And the answer was no. The treatment was generally effective across the diversity of presenting emotional complaints. We asked, is the treatment uniquely effective for one age group? And it turned out that statistical analysis demonstrated that the treatment was uniformly effective across age groups. We asked, was it more effective for women or for men? And we analyzed treatment impact, and the positive treatment impact was sustained across men and across women. Finally, we pushed it to the wall, and we wanted to know whether perhaps there was one uniquely successful therapist, one charismatic therapist who was pushing these positive results. So we analyzed positive treatment impact as a function of 6 or 7 different therapists, because it's critical to know whether a manualized, that is, a systematic, manual-based delivery of this treatment works effectively. And we found equivalent positive impact across all different therapists using a manualized, that is a systematic guideline rule book, if you will, for treatment delivery. So the strengths of the study are 3 replications of a positive impact of an effective, cost-effective, and time-effective treatment for presenting problems of emotional distress. A strength of the study is that all therapists were equivalently effective. It worked equivalently well across men and across women, across age groups, and across different presenting complaints.